Hi, good afternoon. Welcome to this session on Rainbow Health in Hong Kong. And in this session, we're very, very happy and very proud to have Dr. Winston Goh to give us a talk. And let me very briefly to introduce to you about Dr. Goh. Dr. Goh is a family physician who obtained his medical degree from the University of Hong Kong, and also he did some overseas training in the UK and the US. He moved back to Hong Kong in 2015 with his husband. Dr. Goh has a particular interest in healthcare education for the LGBTQ community. In San Francisco, he volunteered at the API Wellness Center from 2010 to 2015, caring for homeless, transgender, and cisgender patients with HIV who have no access to traditional healthcare. In Hong Kong, Dr. Goh has also formed the Hong Kong LGBT Medical Society with the mission to promote LGBT plus healthcare and education in Hong Kong. Additionally, the society also hopes to encourage LGBT plus diversity and inclusion to ensure that LGBT plus medical professionals in Hong Kong can bring their authentic selves to work. So let's welcome Dr. Goh.
Thanks, Travis, and thank you, AIDS Concern, for inviting me to talk about this important topic today about LGBTQ plus health service development in Hong Kong. I hope in the next 20 minutes or so, I can impress upon you the importance of LGBTQ plus awareness in your everyday healthcare practice. Whether you're a doctor, a nurse, social worker, or anyone who's working with patients, I think these tools will equip you to become more patient-centered and more understanding towards your LGBTQ clients. So I'm gonna try to move the slides. These are my objectives. Why is LGBTQ plus sensitivity in healthcare services important? How we can achieve this? What is the situation in Hong Kong locally compared with overseas? I'll talk about the Hong Kong LGBT Medical Society and what this is about. Finally, how the medical profession and the general public can foster a more tolerant, rainbow-friendly clinical environment. So a little bit about myself, as Travis had mentioned, I'm a cisgender gay family physician. I did my medical training in Hong Kong University and subsequently went overseas to some postgraduate training in the US and UK. This is a picture taken in 2014 together with my husband in San Francisco when we were still able to travel freely. And this is a fundraiser event that I attended for the Asian Pacific Islander Wellness Center. So the API Wellness Center is a NGO very similar to AIDS Concern. It provides health services, education, research, and policy planning for the San Francisco community. The center primarily caters to gay and lesbian and transgender clients, as well as people living with HIV. A lot of those patients also were homeless and lived in substandard housing. The clinic was free and open to all, and the mission statement was to transform lives by advancing health, wellness, and equality. So through my experiences there, I learned how to become more competent in taking care of LGBTQ plus clients. So before I jump into sharing a case I encountered in my clinic, I would like to spend a few minutes talking about the terms sexual orientation and gender identity. I think these two terms are frequently confused. So I'm going to illustrate that by looking at the genderbread person you can see here on the screen. So both sexual orientation and gender identity are multidimensional, not something that you will know right off the bat by looking at a person, because it all happens in the mind. If you don't ask someone, you won't know. Hence, it is important to stay open and non-judgmental. You can see here in the genderbread person, there is a brain, a heart, and the sex symbols, the male and female gender symbols. So the gender identity, the brain, refers to one's internal psychological experience of how one sees one's gender. And for most folks, it's pretty simple. It's either male or female. But for transgender people, gender identity does not always match the gender they were assigned at birth. Sexual orientation, on the other hand, refers to the heart, refers to one's romantic and emotional attraction towards the same sex or the opposite sex. So for gay and lesbian people is an attraction towards the same sex, whereas for heterosexuals is attraction for the opposite sex. And for bisexuals is attracted to both sexes. Gender expression, on the other hand, refers to how one expresses oneself towards the outside world, the way you wear your clothes, the way you comb your hair, the way you sit. All that can be masculine or feminine or something in between. Bottom line is that our external genitalia does not dictate our gender identity or sexual orientation. Way round. So let's move on to our case example. So this is a lady, her name was Letitia. She was a 30-year-old African-American transgender woman who came to my practice. And this picture is not what she really looked like, but it's something I found on the internet. But suffice to say, this is what she looked like when she came to my clinic. When she speaks, you can still tell she's a man because of the male masculine voice, hence the male to female transgender woman. Complained of anal discomfort for several months, and she thought that she had hemorrhoids, and she wanted me to check. So on physical examination, I examined her together with a chaperone and found that she didn't have hemorrhoids, and what she had was a large exophytic growth in her anal area, and it turned out that she had anal warts. Upon further questioning on her sexual history, I realized that she was HIV positive and she had unprotected sex with multiple sexual partners. And the reason for doing this was because she needed the money to pay for her medical transition procedure. Just got out of jail. So you can imagine someone coming in like this, there was multiple things going on in my mind. First of all, I had to connect her with a surgeon to take care of her anal warts. I also had to connect her with care so that her HIV can be treated properly, to get her the proper medications, and lastly, to speak with a medical social worker to make sure that her finances are taken care of. So over the course of my 3-year volunteer experience at the API Wellness Center, I realized that there was a genuine health need and health disparity. Most of these clients did not feel loved or supported or accepted by their society, and many endured harsh discrimination and mistreatment from members of their family, the healthcare system, and people around them. Most of them just wanted someone to listen to them and hear them out. And it wasn't so much about medication as it was support, social support, mental health needs, and even physical needs like just having a warm meal. So why is LGBT sensitivity needed? The reality is majority of LGBTQ, in particularly the youth, higher rates of mental health problems, higher rates of depression, anxiety, post-traumatic stress disorder, being bullied at school, substance abuse and addiction compared to the general population. We can see the statistic up here, 4.5% of the US population considers themselves LGBT, and a third of them have mental health problems. And transgender youth risk is even higher, 92% for ages less than 25. It's extraordinarily high. And why is this the case? The reality is they don't feel loved or supported by members of the community. And us as healthcare providers, we have a duty of care to care for these individuals, regardless of their sexual orientation and gender identity. And the goal is to improve patient outcome. We don't want to see any more people dying unnecessarily because of who they are. What is the situation like in Hong Kong? Unfortunately, local data on health disparities amongst the LGBTQ population is very limited. But just 1 month ago, if you have heard the news, there were these 2 female students who committed suicide, jumped off this 23-story residential building in Shaoqian. They came from a prestigious secondary school in Happy Valley, both only 14 and 16, and they left a suicide note on the rooftop. And sources said that both of them were lovers, and one was airing grievances about the relationship towards a social worker. We don't know exactly the ins and outs, but most likely the relationship was not tolerated by the school or the families, and they felt trapped and hopeless and ended their lives. So the goal is try to avoid these situations from happening. And how can we do that? The best way is for healthcare providers to create an environment that's welcoming for them. How we can do that? To achieve LGBTQ plus health confidence is firstly to create a safe environment so that patients feel comfortable talking about themselves so that they can feel supported and not stigmatized by the healthcare worker. Posting rainbow stickers and brochures and magazines about important LGBTQ plus issues such as safe sex, pre-exposure prophylaxis for gay men, hormone therapy for transgender people. All these things are important to convey that you are welcome. As soon as a person walks into the door, you know that they are safe. What else? You can acknowledge relevant days of observance in your practice. For example, this month is June, which is Pride Month. It is an opportunity to honor those, the 1969 Stonewall movement in Manhattan. It was the tipping point of the gay liberation movement in the US. It also commemorates members of the community who lost their lives from hate crimes or HIV or AIDS. So by putting the celebrating this in your practice, it makes a huge statement towards your LGBT clients. You can also be inclusive in your intake forms using words such as partnered in addition to marital status. This also is important, and adding transgender option to your male and female checkboxes will help make your clients feel more welcome. Excuse me. So also don't make any assumptions about gender identity or sexual orientation. Excuse me, sorry about that. Well, next, what else can you do? You can learn to embrace differences. Understand that the LGBTQ plus population have unique differences compared with the general community, which is why staff training is very, very important. Those who work in the front line need to cast away their internal prejudices and also patient confidentiality. I've heard a patient one time telling me when he entered a family planning clinic, the nurses was shouting his name in the corridor and saying, please come and collect your HIV. That's a definite no-no. You have to respect a person's privacy, especially when it comes to sexual health and important sensitive information. Taking a proper sexual history, asking open-ended questions, using the correct pronouns. All these measures are aimed at making patients feel welcome and loved and supported. So I talked about how to do this. The next is I'm going to segue and talk a little bit about the Hong Kong LGBT Medical Society. This is a registered organization under CAP 151 Society Ordinance in Hong Kong. It was a society founded by myself in 2018 together with two other medical professionals in Hong Kong. When I came back to Hong Kong in 2015, I felt there was a lack of support and unity amongst the local LGBT plus. And the goal of the society is to promote, firstly, LGBTQ plus health education in Hong Kong, but also to encourage health professionals to bring their true selves to work. I feel that if healthcare professionals are comfortable and open about their sexual orientation and gender identity, it brings a huge positive message towards the patient. If you are comfortable in your own skin, then your clients will definitely be open about sharing their private lives to you, and it also speaks volumes for the stigma that surrounds being LGBTQ. So over in 2019, unfortunately, due to the pandemic, we weren't able to do very much social gathering because of social distancing. But here are some of the things that we've done in the past. So we did happy hour at Time Bar. You can see a picture here of some of our members enjoying themselves. And then also some more serious things are September 2021, we held a CME seminar for the United Nations Hospital and talked about sexual and reproductive health amongst the LGBTQ+ community. Current initiatives are in place. You can see here we do have a website, and there's website content enhancements. There will be hyperlinks to reputable articles on LGBT health and perspective articles. There's a focus group study being conducted at the moment to identify deficiencies and areas for improvement, CME activities for healthcare professionals, and also educating the future generation of doctors and nurses, working with Hong Kong U and CUHK on LGBTQ awareness in healthcare. Next, I'm going to segue and talk a little bit about the Dr. Rainbow scheme. This is an initiative done by AIDS Concern, and this is how I got connected as well. This is how doctors can be involved. By learning about LGBTQ+ culture, you go through training workshops to acquire the skills, the lingo, become more LGBT friendly in your consultation. If you are more effective at talking to your clients, this will make a huge statement for yourself, but also for your patient. I encourage all doctors to join this. And finally, what can you do to foster a more LGBTQ+ friendly environment for the public? It's about getting educated. It's about visibility and showing support. So for these local LGBT organizations such as Pink Alliance, Pink Alliance is a nonprofit organization and registered charity. Their mission is to advance dignity, acceptance, equal rights for LGBT people in Hong Kong, community engagement, and public education. So by supporting these important organizations like Hong Kong Gala and other resources here, you are helping the LGBT community at large and removing the stigma of being LGBT in Hong Kong. Lastly, I would put in here, these are some resources that the first one is an LGBT toolkit where you can make simple changes to your clinic to make it more LGBT friendly. The second resource is about transgender health protocols produced by the UCSF or San Francisco to help equip primary care physicians to meet the needs for their transgender and gender non-conforming clients. And lastly, the Hong Kong Medical Diary. This is an editorial article that I wrote back in March, which summarizes all the things that I've talked about today. And so I'm open to questions and answers.
Right, yeah, excellent. Thank you very much, Dr. Goh. And I forgot to introduce myself. I'm Dr. Travis Kong, and I'm I also teach at Hong Kong here, and I'm the chairperson of AIDS Concern. Anyway, yeah, we got two questions for you comes in, and then the first one is so Dr. Goh, are there any sort of changes in the pattern of communication between doctors and LGBTQ patients in the past few years? Example, do you think patients now are more willing to disclose their sexual orientation, or what? So what's your observation?
I think, yeah, in general, I think people are a little bit more open, especially the younger generation. Patients feel more at ease when they want, especially talking about their sexual health or their gender identity. They are less reserved compared with the older generation. And I think, I don't know if it's because being LGBTQ is more tolerant in the society, because things in the media or social media, it's being more advertised or publicized. So I do find that my clients are more open, but still there is a challenge. You have to be able to be sensitive when the patient comes in the door to know that they're ready to disclose that information. And it's about building trust. It's about building trust with your patients and being friendly to them and knowing about their background. Because sometimes they may when they walk in the door, they may not feel that they can trust you. So they don't trust you, they're not going to tell you about their private lives. But I do feel that the younger generation is more open.
Uh-huh. Okay, yeah, that's the age difference. So how about like, for example, like class or like in terms of occupation or gender and other components? Do you find sort of like, differences?
Occupation, not so much. I don't think it's about occupation. It's about perception of whether it's okay to be open. And so in our practice, we have we're very open. In our waiting room, or as you walk into the door, there is a sticker saying we are LGBT friendly. So right off the bat, patients know that if they speak to any physician, doesn't have to be myself, but any of the clinicians who work in the practice, they have as a policy of tolerance, and that patients do not have to fear being judged for who they are. So it's about making those little changes in practice to become LGBT friendly. Of course, that when the patients down with you, you have to use your doctor-patient relationship and other skills that you've learned to try to get as much from them as possible and be open. But I don't think it has to do with the profession that they work.
Okay, thank you. Yeah, we also got another question. It's like, how important is it for medical students to receive LGBT plus related training? And how can this actually be able to achieve? What do you think?
Yeah, it's very, very important. I mean, I have to say, when I was going to medical school many years ago, I never received much in terms of LGBTQ awareness. It was not even talked about. I think we only had one lecture talking about sexuality, and it was a 30-minute or discussion, and really it was very, very limited. So nowadays, there's so much more information out there, and the internet and whatnot. But even within the curriculum of our local universities here in Hong Kong U and CUHK, it's not required that to learn about LGBTQ health. But I think this will slowly change as we continue to push for this with the medical schools. But it is important. You think about it. If those doctors who are going to be taking care of patients, they are not equipped at taking a proper history or on knowing what lingo or what ways to speak to your patients, then clearly they won't be able to provide the best care for their LGBT clients. So it is very, very important that the future generation of doctors and nurses on this topic. I hope that in the very near future, all the students, doctors and nurses, the other allied health professionals who come out from the schooling are equipped to be able to handle patients who walk in the door with LGBT issues.
Okay, well, so yeah, I also have because we got a little bit more time, so I also have one more question. Is about the Hong Kong LGBT Medical Society. So how can that society in some way help promote and what sort of challenges that you're now receiving, and anything you would like to share with us?
Well, we have about 60 odd members in our society at the moment. But the challenges are finding people to do the work. So because obviously we are all very busy people, as we know, doctors and nurses, and this is not a paid, it's a entirely volunteer organization. So we don't get paid for doing the things we do. This is all community service. So finding the right people to do the job of educating the public, and also educating other doctors requires time and effort. So it's about finding the right people, or having people step up and do the work, because you're basically paving the way for the future generation. And you're allowing the future generation of peoples to have a better than what we had before. So yeah, I encourage more doctors who, if they feel the calling to help out, to join our society. And we have a WhatsApp group that we try to do communications as well as social events that we hold regularly, and hopefully with COVID permitting, we can do more social gatherings to meet more folks, but also through the CME events, we're hoping that we can communicate the message to more people in Hong Kong, not just the public, but also the greater medical community as well.
Yeah, it's excellent. Yeah, because we actually talk about different things, right? We talk about doctor-patient relationship, we talk about students, and we also talk about doctors, among doctors, professionals. Like, so in general, have you received sort of like resistance from the medical professional? I mean, like, yeah, I mean, traditional, the kind of like medical professionals, sometimes they might be quite homophobic or LGBT phobic, like, so.
Yeah, I mean, the
society, like, how is actually being received, by the mainstream medical professionals in Hong Kong.
I mean, I have to say that the mainstream medical profession probably doesn't know very much about us, and the only thing, I talked about the United Christian Medicine Hospital seminar. That was the first time, like, the government hospital formally invited our society to talk about LGBTQ health, and the reason behind that was because there was a patient, a client who kind of made a complaint towards the hospital. Hospital needed to make some sort of change to their existing policy, which was what prompted us to be involved. So the hopes is that the local medical profession can become more friendly and more welcoming. But that also takes time. It's not something that happen right away.
Right.
It's about making ourselves known to everybody. And then yeah, it's gonna take time and opportunities where we can work.
Okay, well, thank you very much. Like, we don't have any more questions. Like, so maybe we just end the session here then.
Okay.
Thanks so much for the go.
Thank you very much, Alice.
Like, yeah, we now go back the session, handing back to Andrew. Thank you.
Thank you.